With the worst of coronavirus still yet to come, there's concern about overwhelming our hospitals. Some say before long, healthcare providers will have to decide who to save. It's especially concerning among seniors and the disabled who fear they may face discrimination and be left to die. Paul Strand talked to a leading bioethicist who's working to prevent that from happening.
Professor Camosi, right now, some states, are they considering actually rationing healthcare over this coronavirus?
Yeah, not only considering, but the state of Washington State actually has an approved protocol that not only is going to consider age, but also things like ability, physical ability, cognitive ability. And that's, as a bioethicist who engages not only in Christian circles, but secular ones, that's fairly common. We're just now making it very, very public in ways that are quite disturbing.
Wow. So what do you think this is probably going to be if the coronavirus gets as bad as we expect? Do you think this is going to spread across the nation and that like what do you think probably the criteria will be? Do you think it'll be age, disability, that kind of thing, that those people will be discriminated against?
Well, I think there will actually be quite a debate. For instance, New York, where I teach, we have a protocol from 2015. Now, it's not clear where to follow the protocol, but if we follow it, it says explicitly no focus on age or ability should be considered. And it explicitly says something that's quite true, which is this would be a violation of the civil rights of people who are older, right, and people who are disabled. So if you pit Washington State's protocol versus New York's protocol, and again, it's not clear what's going to actually be filed. That's what makes this so dramatic, is we just don't know what's going to happen. But there's quite a difference, obviously, between those two, and it may come to the HHS, Health and Human Services Office of the federal government, or even courts to decide what we ought to do.
Wow. Now, you and a couple of other prominent bioethicists have gone to legal people and asked them to send out a document to the states, right? And what's basically being said in that document to the states?
Yeah, well, the document that was set out in a press release earlier this week did a very detailed legal analysis of this and concluded, and I'm not a lawyer, I'm just a bioethicist, but the lawyers that did this legal analysis said, well, we really haven't tested this principle in a pandemic for a very long time, but their analysis is you're still not allowed to violate someone's civil rights even in a pandemic. So we're going to be rationing healthcare. I mean, the number, we just need to do the math. At this point, it's pointless to deny, unless we have a miracle drug that somehow shows up at the last minute. We're going to be rationing healthcare. The question is, will we preserve our humanity in the process? Will we follow the very basic values and ethical principles that we hold dear? Or are we going to turn it into straight up no chaser utilitarians who just say, well, we're going to maximize quality adjusted life years or something like that?
Which is funny because doctors don't even they usually will say that a patient should die long before that patient, right? So that's like the people who will be deciding these things don't even really have good judgment on this.
I know very many good doctors, good-hearted Christian doctors, also good-hearted non-Christian doctors. But in general and in the main, doctors are some of the worst people we want making quality of life judgments. They often rate their patients' quality of life below what the patients themselves rate their life as. And they also think wrongly that patients would rather have a shorter duration of life and have higher quality, when in fact the opposite is true. Patients would rather have a longer quality of life, or a longer life compared to a greater quality of life in a shorter time. So maybe we ought to start thinking about these things, but maybe doctors not ought to be the people on the front lines making those decisions.
All right. Well, thank you so much, Professor Charles Camosi in Fordham University.